There we go.
Thank you.
Good morning. Welcome. It's really nice to be on a cool summer morning in Arizona. They're rare when they happen, so we're glad to have it. My name is Rod McLeod. I'm here with Protect Our Care and a wonderful group of advocates and leaders in the healthcare space, talking about the campaign of sabotage that's created a healthcare emergency from President Trump and the Republican administration and many attorneys general, including our own Attorney General here in Arizona, Mark Brnovich, who has thrown the weight of the state of Arizona behind a lawsuit which would overturn the Affordable Care Act. If that were to happen, not only would millions of Americans lose their health coverage, but about 500,000 Americans right here in Arizona would lose their health coverage. I'm not going to say too much. I'm just going to serve as MC. We've got a wonderful group of speakers. First, we have the Democratic leader in the Arizona House of Representatives from Legislative District 4, Charlene Fernandez.
Thank you, Rob, and thank you everyone for being here. You know, frankly, I don't know about the rest of you, but I am tired of coming here and fighting to make sure that Arizonans have quality health care. Arizonans deserve not to have uncertainty when it comes to their health care. And the contrast is very clear that Republicans are trying to cause chaos and uncertainty among our Arizonans. The one thing that Arizonans deserve, the thing above most, is that when their children get sick, when they get sick, they are able to go to the hospital, see a doctor, they can make sure their children are immunized. But we have elected officials right here, sitting here today at the Arizona State Legislature, there at the U.S. Congress, that are putting barriers to make sure that we don't have that certainty. We are here today to talk about those issues. I have great people behind me that will be telling you stories from the front lines. I am here just as the leader of 29 members, 29 Democrats that are here to say that we want to protect your health care. We want to make sure that you have quality health care and that is something you will not have to worry about. So rest assured, we will be here to fight, the 29 of us, and hopefully in the future there will be more. Thank you so much, Rob.
Thank you, Leader Fernandez. Next up, we have a healthcare advocate and cancer survivor who's going to share her story, Laura Packard.
Hello, my name is Laura and I'm a small business owner with insurance through the exchange. 2 years ago, I walked into a doctor's office with a nagging cough and walked out with a stage 4 cancer diagnosis. But I'm still here today thanks to the Affordable Care Act. I went through 6 months of chemotherapy and a month of radiation to be in remission today. And that's care that I could not have paid for without my health insurance. Now I'm uninsurable without the protections of the Affordable Care Act. Just like 130 million Americans, I have a pre-existing condition. I can't go without health insurance because if my cancer comes back, I need care to stay alive. At the beginning of this year, I had to move because I needed to make sure that I could have health insurance if this court case demolishes the Affordable Care Act. We shouldn't have to live like this. You shouldn't have to choose between your home and your health care. So that's why I'm on this tour sharing my story, because it happened to me and it could happen to anybody. That's why we need to protect the Affordable Care Act, and we need to make sure that the courts and this administration does not overturn the protections of it. Thank you.
Thank you, Laura. I don't know if people saw the Gallup News report. Polling indicated that since President Trump has taken office, the uninsured rate in this country has gone up, and there are 3 million fewer Americans who have health coverage today than back in 2016. So when we talk about a national health care emergency, we're talking about sabotage of our public health system where fewer and fewer people are able to get the care they need. The next person who will be speaking to you is a doctor and cancer research advocate, Dr. Hiral.
Thank you, Rod, and thank you to Protect Our Care for highlighting this incredibly critical issue that not just Arizona faces, but the entire nation. As he mentioned, I am a former ER physician, and I will tell you, the emergency department is that front line. It's where folks go when they don't have access to health care. It's where people go when they are not part of the system and they don't know if they can afford primary care, but they just need to see a doctor. And I will tell you that one of the first things that prompted me to run was the idea that 20 million people would lose their health care if the GOP had their way and they repealed the ACA. And that is unconscionable, because to me, I absolutely see health care as a right. We are the only industrialized nation that does not ensure that every one of our citizens, every one of our residents has access to quality, affordable health care. That is unbelievable in 2019 that we're having this conversation. And I will tell you one personal story of a person that I spoke to on the phone when I first decided to run that reminds me every day why I'm running. It's a young man named Pete, who was in his 30s, small business owner, had 2 small children, married, and he got very excited when he heard that I was running and with my background. And he told me that about 4 years ago, he had been diagnosed with a rare form of blood cancer. And being a small business owner, he didn't have employer-based insurance. And if it had not been for the ACA, he would have not gotten coverage. And it was because of the ACA that he was able to get covered, and he was able to get the treatment and then subsequently be cured. And he said in no uncertain terms, if it had not been for the ACA, he would have either gone bankrupt or been dead. And that is the core of this issue, of what we can do to help families all across this country that are struggling with real life crises. We hear stories day in and day out of patients, diabetics, who are rationing their insulin. We heard recently of a mom who brought her child to the ER but didn't actually go into the emergency department, waited in the parking lot to see if her child might have a seizure related to a ingestion because she was afraid she would incur a large medical bill that she would not be able to pay. That is not the country I want to live in, and I know we can do better. We're talking about almost 3 million people who have pre-existing conditions in this state that would be impacted on day one if this lawsuit goes through. We can do better. We must do better. We have families depending on us every single day. So let's go out there and remind everyone that your vote matters, your voice matters, and healthcare is a right.
Well, before we open up for questions, I just wanted to acknowledge that Congressman Gallego's office has sent a representative, Lynn Cordova. Thank you for being here. And also Raquel Tehran, the representative of the people in Legislative District 30, the west side of Phoenix and Glendale, is also here. We thank them both for showing up and lending their support. With that, members of the press, if you got any questions for any of our speakers?
I just wanted to interview.
Okay. Well, thank you. We're going to wrap up. Thank you all for being here. And the Care Force One Ambulance Healthcare Emergency Tour will continue, be in Tucson tomorrow, driving across the country to really talk to Americans about what we're up against with this healthcare emergency. Thank you so much.